So Dr. Cannon, I've been thinking lately. I got a couple questions for you.
Fire.
Away. So when you have patients with carpal tunnels, some of them have something called an open release, but some don't. What is the difference between the two?
So open carpal tunnel release is usually using an incision that's slightly longer than a thumbnail.
Okay.
And by doing so, we go down and find the ligament overlying the nerve and release the ligament that way, where you can directly see it with your own eyes. Endoscopic is using a device, it's a little smaller incision at the front side of the wrist. And usually you look through a TV camera, where you can see the ligament through a TV camera and release the ligament from the inside of the wrist. Both of them achieve the same purpose of taking the pressure off the nerve to take the symptoms away, but it's just two different approaches to use.
That's really interesting, because it seems so simple when you're saying it, but I feel like it's a bigger deal than that, right? I mean, like, people have carpal tunnel every day.
Right, but both of them are equally effective to get rid of the symptoms, and I think it just comes down to what the patient really wants as far as their preference.
Interesting. So when I see them in the clinic, both endo and open both have a lot of scar tissue. Have you ever noticed that?
Right, and that kind of leads me to ask you a question.
Oh.
What is the best way to manage this after surgery as far as getting rid of the scar tissue?
Scar tissue is the most frustrating part of the human body healing, I think. Like, your body naturally does it, and we need some. It's like a concrete, it's like a glue. But the body sometimes doesn't know when to just stop. So then when I get them, unfortunately, we have to start working on massaging day one. And I don't mean with like lotions and oils and things. Sometimes it's just with soap. Just touching it without anything, because that nerve that you released does not appreciate our touching it now. So the biggest thing that I tell all my patients, start massaging it as soon as you can. Even if it's just gentle circles, 25 times. The best thing for scar tissue is massage, ASAP.